It's absolutely a pleasure to have you all here and looking forward to a great meeting. My name's Nigel Pollard. I'm the chair of the non-profit Empowered by Evidence. We're located in New York, and we were established in 2014 to help to inform people about choices of natural health products based on evidence, and in particular about the reliability of the product as well from batch to batch, so that you can link the evidence to the products that you can prescribe. This meeting is about helping healthcare professionals making informed choices of products, and obviously in the interests of their patients. The model that we've built for today, and we have a number of other webinars coming up in the course of this year, is to have a medical professional helping to give us the context within the mainstream medical setting of where natural health products fit. I'd like to introduce you to our third speaker, who is Julia Walsh, as you can see in the slide here. So Julia is CEO of Brand Medicine International. Now, she is a global pharmaceutical marketing and healthcare communication specialist. She started, in fact, in research with the CSIRO here in Australia, and then transitioned to significant roles in global marketing agencies before starting her own business nearly 5 years ago. She calls herself an infodemiologist, which I thought was a great title. And she has an inherent curiosity to understand emerging trends in data science. And she's a global pioneer of this really interesting application of search listening to healthcare. And you'll see in her talk some amazing insights into what's in the mind of your patients in the real world. And sometimes these are conversations they're not having with you as a healthcare professional. I'll hand over to Julia, and don't forget to put any questions in the chat. So take it away, Julia.
Thank you so much, Nigel. And thank you as well, Oren and Con. Your presentations were fantastic. And I think shifting to this topic now makes a lot of sense to provide the whole picture to the attendees that have joined us today. So we're going to be looking at the experience from your patient's perspective when they go online and they exchange those questions for health advice around this particular topic of anxiety. And hopefully some of these insights might inspire some thoughts around the approach of healthcare professionals, particularly as that online digital landscape is fast evolving with the integration of AI into that experience. So I'm a search listing specialist, as Nigel mentioned. I'm the author of What We Really Ask Dr. Google, which looks at healthcare insights in the digital age. When the ChatGPT and other AI tools started to really become more mainstream, I worked with a lot of thought leaders in the healthcare industry to put together this document, Responding to AI Disruptions in Search, which is available to download for free. And it's a guide to transforming your internal approach to the new digital landscape. I'm a fellow with HitLab, which is based out of New York. They're the Healthcare Innovation Technology Group associated with Columbia University. And as Nigel mentioned, I run Brand Medicine International, which specializes in analytics on this front. So today we're going to be exploring the reliance on and importance of online search in relation to anxiety. We're going to be looking at the scale of this as people seek advice on managing this condition, and consider how the information that they're getting is shaping decision-making. And when you scale it up as well, how this is influencing quality use of medicines, public health outcomes when you consider the number of people that are afflicted by this condition, as well as, of course, the experience online and how people are guided to the content that is informing those decisions. How does that impact the commercial potential of businesses in this area, both from a treater and clinic point of view, as well as the natural treatments that are available over the counter? And then we're going to also be looking at what we can learn from these insights that are available from search query data, because it's a living data set and people turn online by themselves. and they're often very unfiltered in the way they ask these questions. So by aggregating the anonymized search query data, we can get really deep insights into what they really want to know, things they might not be comfortable to share with their friends and or healthcare professionals. And then, of course, we need to look at the profound influence of AI as it is transforming this digital information experience, because we need to have a future-proofed way of approaching online customer engagement. We're shifting from a menu of websites that we've all been very comfortable with navigating since Google launched, essentially, to a seamless, continuous conversation with AI. And we need to look at how this is going to impact the way patients seek support for managing their anxiety. If we look at macro trends, and this was really interesting to note in the first presentation by Oren about Americans shifting from the land of Prozac to the land of Xanax, we see this as well in search query data. It is a reflection of our collective consciousness in that way. So the blue line is anxiety being searched for as a topic over time, and you can see that it has increased considerably. It's overtaken depression, and the rate of search around anxiety is now, at this point in 2022, 3 times higher than it was at the baseline back in 2004. If we jump to today, we see anxiety is now searched at a significantly higher rate than depression. And then if we add in as well depressed, when we look at search query data, we have to really think about the words people use, and they might not always use the word depression to look up around their depression. They might talk about being depressed. So we need to aggregate that data as well. But even if we do that, anxiety is still a much more frequently sought topic. This gives you an insight into the Australian data, and every market is different, where we're looking at the topic of anxiety. There are over 300,000 different questions being asked every single month on the topic of anxiety in Australia, and depression and depressed, we're getting around 300,000. The total monthly volume of questions on anxiety, and we've only got a population of around 26 million, is 2,679,000. So there's that many exchanges in Google alone, and that's not even accounting for other search engines and answer engines, as these AI tools are now calling themselves. So there's just an incredible reliance on these online tools for gaining information about anxiety. So it's also good to know, like, looking at this data, it can provide you so many different interesting insights. And I always love to look at what time do anxiety-related searches peak. So this is looking at a 24-hour period, and the 100 represents the highest frequency of questions at any given point in time. And so just I'm curious to know if you're already guessing what's happening here. But 3:44 a.m., we are getting the maximum volume of questions being asked about anxiety in our country, and this would probably be pretty consistent around the world. And these long form questions, if we tap into them, so going beyond keywords and just looking at the actual questions people are asking, can really reveal the depth of patient concerns. So here's one snapshot of the kind of questions that we study that are available in aggregated search query data. And this gives you incredible insights into the most frequently asked one here is, can anxiety and stress cause chest pain? Can it cause memory loss? Can it be cured? Can it cause diarrhea? And we looked before in some of the earlier presentations around those other aspects of this disease, such as gastrointestinal complications and headaches and things like that. We see the population of patients turning to the internet, and they're experiencing these symptoms, and they're wondering if it's correlated with and or caused by the anxiety that they know that they have. So I find this data really fascinating. And if we want to be answering their questions, we need to be creating content that basically mirrors these headlines and responding to that. Search is also a really personal thing. And by looking at the search query data and consolidating data that for this condition includes the words my, These are all patient-generated questions. It filters out all the healthcare professional questions and anyone else that might be looking around this topic for research or other purposes. If someone's asking about my anxiety, they are a patient. And they're probably someone who's had it for a long time. So I'm reflecting that these are established, long-suffering patients that start to talk about it as my. And the reason why I'm assuming that is because we've done a lot of work to correlate the patient journey with the stages of grief. And it's not until people have had a condition for a long time that they shift to the acceptance stage and they start referring to something as my cancer, my diabetes, my high blood pressure. So here we see people talking about my anxiety ruining my life. It's making me sick. It's killing me. It creeps inside of me. I get goosebumps when I read these questions because behind every one of these questions is a person who is crippled by their anxiety, awake at 3:44 in the morning and seeking support online. And why it's really important to understand this is because they're not going online just for some theoretical exercise. This is real. And the health advice that they get in return to this forms their opinion and it drives their actions. So when you think about the quantity of questions in Australia alone, we've got over 2.5 million questions being asked a month. Then 2.5 million times we're having this influence that causes this cascade effect that drives behavior. And that's why it's important to think about the impact of the quality of the information being fed back to them and how it's driving quality use of medicines and all of those kind of things. Enter AI. When ChatGPT launched, we quickly saw that this was going to be potentially integrated into search engines. So going much more beyond making your work more efficient and developing content, it is going to become an answer engine. And we have seen a real increase in the integration of AI into search engines. And this is driving a shift from keywords to conversations. So people don't look up a URL when they go online. They haven't done that anyway with the way we search with the traditional menu of options that are sent back to us by Google. They are asking questions in their natural language. And this actually fits perfectly with AI tools. And users are finding these much more relatable than the traditional search menus of websites. This digital information experience is transforming as a result of that. And soon it's very likely that nearly all responses are going to be curated by AI. So this is the traditional way that we used to get information online. And honestly, I feel if you're looking for the best natural way to manage anxiety and you get this kind of answer, it's going to cause anxiety. I don't even know where to look on that page. So let's compare it to an AI-driven response to the same question. This is exactly track and display Google because it's beautiful.
Julia,
Yes.
it seems to be affecting your audio somehow.
Okay.
It might be that you need just the video to run to show this and people just watch.
So hopefully you saw that.
Yep.
Can you hear me now?
That's good. Yeah, loud and clear.
Great. Yeah, so you can see that the best natural way to manage anxiety was not initially responded to with any treatment options. It was giving you breathing exercises and things like that. So as a user, I had to say, I'm looking for something to take. And then it provided me some options. And actually I saw lavender there as well, which is interesting. And we see these search engines starting to grab share. ChatGPT is now actually actively soliciting search business. So people are being diffracted all over the place. And one of the big questions that we seek to answer with our team is, where do these search engines get their information from? Because it's really important to know the content that's going into these AI curated answers. So this is a look at GPT. I'm calling it GPT. Step aside Dr. Google. And this is an example of what's happening here. We're starting to see the long form questions turn into conversations. As a user, I popped this one in to get an example for you. I'm feeling really stressed out today. Can you recommend some ways I can manage my anxiety? And this response is so beautiful. It starts with, I'm really feeling sorry that you're feeling this way. This can be overwhelming, but there are definitely some evidence-based strategies that can ease your mind. Here are a few to try. I've actually put in the comments all of the rest of it. It's such a beautiful answer. If I was feeling stressed, I would love this. And then at the end, it actually says, would it help if I guided you through a short breathing or grounding exercise right now? Or would you prefer a distraction, like a fun fact or a gentle story? So you can see how these tools are actually starting to become the healthcare consultant. In fact, there was some studies done on answers that were chatbot-based answers. Some of them were generated by AI and some of them were generated by actual physicians. And the rating given by patients on both quality and empathy was that the chatbot far exceeded the physicians. So we're starting to see a gravitational shift towards a deeper relationship with not just Dr. Google, but all of these AI answer engines. And the big question is, how will the role of the healthcare professional change in this context? Some of the key shifts that we anticipate is that patients will deepen their relationship. This will address the unmet need of that support that's required at 3 a.m. And it may, in fact, reduce the time that they feel they need in a consultation, because we talked about talks and meds being the key pillars of treating anxiety. This is actually starting to do the job of that conversation and be in a very supportive and empathetic way. The other thing, though, to consider is that AI is going to start to have control over decision-making in relation to non-prescription ways to manage anxiety. And the websites that currently have the highest influence in organic search on this topic are being used to create that chat content responses. So the one that we saw before around Bing offering, when I specifically asked for natural treatments, it was using Forbes.com as the website to source its list of products, which is probably not the website that would be most trusted. Hopefully evidence-based, empowered by evidence might be one they use in the future. But there needs to be work done on the organic presence of those websites in order for AI to even notice it. So I know we're going to be shifting to a Q&A with discussion. I'm looking forward to that. But really, some of the questions I wanted to throw out there is, how can we predict that an AI-driven interface will impact the relationship of people with anxiety and their doctor? And how will it impact their choice of natural therapies? So thank you. Hopefully finished on time.
Perfect. Thanks. Thanks, Julia. Exceptional. All speakers, thank you so much for the amazing precision with your talks and the content as well. So we're now opening up to the panel discussion. So this is your chance in the audience. We wanted, and please share this with all colleagues, anybody in your networks, because we want to help as many people around the world as possible with their informed based choices. All the best, and thank you so much to the speakers. It's been a real privilege to work with you.